The next slide is traveling immediately after surgery tips. As most of you know, I had a lobectomy at the end of October with Dr. Antonoff at MD Anderson, and a lot of people are going to get opinions from her on actually going through with surgery in Houston. And for many of us, even if it weren't in Houston at MD Anderson, there's not large cancer centers around, and you would have to travel for your lobectomy. So again, you want to check with your surgical team before you make any of these decisions, but things that worked for me were to fly first class on the way home because I was afraid of people bumping into me. I was just real sore and nervous, and that also gave me less germs around, I guess, being first class. So my husband, he sat in the back in economy, and my mom and I sat first class so that we could have that extra room. Make sure when you're packing that you think about how much you're taking with you, because you won't be able to lift after surgery. So they didn't even want me pulling my suitcase. So you may need to have something that the person who's traveling with you can pull or carry or whatnot. So make sure that that is a-okay. I did like taking a pillow on the way home, just because if you cough, and that's common after surgery, kind of like just hugging it kind of lessen the jarring, I guess, of the coughing. And then I did, and it was recommended to me from MD Anderson to wear a mask on the way home. I actually wore a mask there because I didn't want to risk getting sick before surgery. But definitely wear a mask home because you are a little compromised because you've just had major surgery, and use your hand sanitizer, wash hands. Another thing you could do, I was able to walk, but for some people you may need a wheelchair. So because you walk in the hospital and then they take you out in a wheelchair to your car or wherever you're going, but you can arrange before you leave the hospital. MD Anderson will actually help you. So I'm sure other places will too, to have a wheelchair, and that keeps people from crowding as well. Most major cancer institutes have some kind of travel assistance program. MD Anderson, for example, they use United. So if they book your flights through United, you do not have a cancellation fee. You don't have a change of date fee. So with surgery, it was kind of up in the air as like how many days you have to be there. So we booked through them on United, and then that way we ended up extending by one additional day with no issue. That just takes a little of the stress and worry out there. Definitely, you're going to be a little tired, you're fatigued, you're sore. So I would recommend tennis shoes, something that you feel stable in, not a flip flop, not a heeled shoe, so that you can keep your balance. Typically, you're given blood thinners the week after surgery, so you don't really have to worry about blood clots after flying while you're flying home. So getting up and walking and all that is typically not an issue. So that's one thing to know ahead of time.